Good morning, everyone. It's time for another Medical Minute. Today, we came out to Colorado Springs Orthopaedic Group, and this is Dr. Jeffrey Watson. He's an orthopedic hand physician. Good morning to you, doctor.
Good morning. How are you?
I'm well. So today we're talking about carpal tunnel release surgery. What is carpal tunnel syndrome?
So it's one of the more common problems that hand surgeons see. It's probably the most common malady that we encounter, and what it is, it's compression of one of the nerves that go into your hand. Okay, it's called the median nerve, and what happens is usually it's for no good reason. Although people always tell me why they have something. The truth is it's like glaucoma. A lot of us are going to get it, okay? And it's not something that you've necessarily done or had done to you. Just a lot of us will develop it. Sometimes it is following trauma, but what happens is the nerve that goes in, the median nerve that starts in your neck and goes down your arm, it goes through a passage here called a carpal tunnel, and it's just it's going over your wrist, and there's a strap over the top of it. And it goes under that strap to do its job of giving you feeling, mostly in half of this finger and these three, okay? And it also controls most of your thumb muscles. And so when people start getting these symptoms, what happens is it gets a little pressure on it, a little swelling around it. And when nerves get any swelling around them, what happens is it's just like your skin. It gets pressure on it and it gets less blood flow to it when there's a little pressure on it. Skin can handle that, nerves can't. They start acting up when they get a little bit of oxygen deprivation. And when they say acting up, what people will often feel from carpal tunnel syndrome or pressure on any nerve is it'll just start tingling and buzzing. A lot of people will experience that. Often on this side of the hand, like I described, but it can. Some people say it involves all their fingers. It often happens at night because of how we sleep. A lot of times we sleep with most of us are curlers. We sleep with our wrists flexed, and that puts a little pressure on the nerve. So anything that puts pressure on that nerve will bring up those symptoms of numbness and tingling, and people will often tell me I wake up in the middle of the night trying to shake my hands. Or it'll happen with certain positions like driving my car or cutting onions or something like that. They'll have a posture that makes pressure on that nerve and will give them tingling, and some people will have pain. It's not just a little bit numb, it's painful tingling.
It's painful. So tingling and pain, when is it time to seek an orthopedic specialist?
Well, I'll tell you, if you do notice that happening, I tell everybody the easiest thing to do is to go to Walgreens or CVS or Target and get a carpal tunnel splint and wear it at night. I tell everybody to do this because it's such an easy thing to do. And you don't have to wear it during the day, but just wearing it at night, and it's a splint that has a shank in it that just velcros around. But what it does, it just needs to be on tight enough to keep your wrist from doing this. All right, go to bed with it and see if that makes a difference in your symptoms. One, it's nice that you're feeling better, which is what we're all supposed to be here to do, but it also gives us some information. If that makes a big difference in your symptoms, then that helps us to know that's probably what's going on. It's not coming from your neck or a metabolic issue that's making you numb. So I tell everybody, first thing, try a nighttime wrist splint, and they're easy to get. You don't need a prescription for them, and if it continues on, then you should seek attention for it.
Okay, when is it time to talk surgery?
So a lot of people will have this transiently. Just because you get it doesn't mean you won't get over it, all right? And so what we'll try to do, again, I'm trying to get everybody to try a splint, and a lot of times we'll try a local steroid injection to get the inflammation and the swelling of the nerve around the nerve to go down. And for some people that makes a big difference. And if this gets better and goes away, good. It doesn't work on everybody. And if it continues to happen where people are they're getting numb and it's staying numb, where it doesn't wake up, then we start talking about surgery. Or if we start your hand doctor will tell you that you're not getting good innervation to this muscle. When you start getting muscle weakness, we're behind. And we'll get a little more assertive about saying we need to do surgery. The other time to do surgery is if you've been having this for so long and you're not sleeping, it's not getting better, and you're fed up, it's okay to do a carpal tunnel release for that.
Okay, and so any other conservative treatments that are available for carpal tunnel syndrome?
Oral medicines don't really do much for this.
Okay.
Okay, you're talking like taking Motrin or things that help us for so many musculoskeletal problems. They're not going to knock out your carpal tunnel syndrome. They may make some aching feel better, but they're not going to have any real difference on that. Okay. Exercises, a lot of people talk about stretching, nerve glide exercises that a hand therapist can go over with you. A bit inconsistent on how they work. Some people tell me they work, and I'm great. I'm happy for them as long as it gets better, but not very consistent on that, I feel.
Got it. Well, nobody wants to live with carpal tunnel syndrome, and if that's something you're going through, maybe it's time to come check in with the doctors at Colorado Springs Orthopaedic Group. For more, go online, csog.net. That's right, csog.net, and that segment, of course, always sponsored by Colorado Springs Orthopaedic Group.